So how are you doing?
I'm doing okay.
So thank you for coming in. First, I want to introduce myself. So my name is Norma. So today we're going to go over a couple of things. One of the first things that I want to go over are the forms that you kind of filled out prior to coming in here. I know the forms talked about informed consent and confidentiality. So everything we talk about in here is going to stay in here and it's going to stay confidential, with obviously the exceptions that we mentioned, which is going to be child abuse, self-harm, or harm to anybody else. So with the questions that we have, some of them are going to be pretty personal. And if at any time you feel like you feel uncomfortable or you don't want to move on, you can just go ahead and tell me that you want to move on from any of the questions and we'll just kind of go forward. And then some of these questions are going to be very basic too. If at any time you want to add anything, just feel free to just add in. So one of the first questions that I want to ask is about your current health. How are you feeling right now?
Okay.
You're feeling okay? What does okay mean?
Like not good, but like not like shit.
Okay. Do you feel like you need to see a doctor?
I mean, I just came from a doctor.
Okay. What happened with your doctor?
Well, what kind of doctor are you asking now?
Well, if you're having any physical pains.
Oh, I mean, a little.
A little bit? Like what kind of pains are you having?
In my stomach.
In your stomach? Have you had these pains before?
Yeah.
You have? Okay. Have you
I
gone to
feel
the doctor?
nauseous.
And you feel nauseous. Have you gone to the doctor before?
No.
No? Okay. Is this something that you're concerned about, that you're kind of worried about?
Well, not really.
Not really? Okay.
It's because I'm coming down from drugs, so
Oh.
it's kind of normal.
It's kind of normal. And what kind of substance would you use?
Meth.
Methamphetamines? And how often?
Well, I just recently got into it, and I try. This is my second time trying to stay clean.
Is your second time?
Yeah, so I know it's kind of what happened, so I just kind of gotta write it off.
Okay. So you know that these are some of the symptoms that you're going to feel when you start coming off of using methamphetamines. Okay, and you said that it wasn't too long ago that you started. How long ago was this?
Like about 2 weeks.
2 weeks?
Yeah.
That was the first time that you tried it?
Constantly.
Constantly. So you had tried it before?
Yeah.
Okay, and how long ago was that?
Like when I was like, I would say 19.
Okay. Do you want to tell me a little bit more about that?
Like why I started using?
Yeah.
Or, I mean, I was always in a very sheltered home, so you know, once I turned 18, everything technically changed. Technically, but not really. So I got kicked out, and I started to like find a place to live, and then I had too much freedom in my hands, and I started to like, how do you say it? Like try new things, try different drugs, and that's when I tried it for the first time, and I used it for about, I'm gonna say like 2 days.
Okay.
And then I just stopped.
And how do you feel about wanting to stop? So I know you're saying you're having some of these complaints because you recently stopped. How positive do you feel about wanting to stop?
I mean, I didn't like the way it was making me feel and the way that my face is looking, so that's why I want to stop. I like the feeling that how it has me when I'm under drugs.
So you like the feeling while you're under the influence,
Yeah.
but you don't like the side effects that you
No.
have from it. Okay, so those are some things that you can kind of help you motivate to kind of stay away from going back to using the drugs. So I know you did talk about your family a little bit. Do you kind of want to tell me a little bit about how your family structure is? How are things at home with you guys?
Well, right now we don't talk.
You don't talk?
We haven't talked
Okay, and
for
who's
about a few years.
for a couple of years? So who's in your household? Parents?
I live by myself.
So right now you live by yourself, but
Yeah.
when you lived at home, who was living at home with you?
It was my parents, my 2 younger sisters,
And 2 younger sisters.
and then just me.
And right now you don't talk to your siblings as well?
No, I talk to nobody from my family.
Okay, so you're completely distanced from them.
Yeah.
Okay, and what kind of initiated that?
Well, when my parents told me that I needed to start paying rent, I kind of didn't take it the right way, so I told them that I was better off not living with them, not having any communication with them. So I kind of stopped I started distancing myself. And I wasn't allowed to see my siblings because if I didn't want any communication with my parents, then I couldn't get to them.
So your parents kind of restricted you from being able to see your siblings?
Well, they didn't have a phone. They didn't have no way for me to reach them. So I had to go through my parents. So because I didn't want no communication with my parents, it was kind of like this is where it's gonna go. Like, if I'm losing my parents, might as well I'm losing all my family, because there wouldn't be another way I could reach them.
Okay, and so you're saying it kind of started out of their want and need for you to start having some responsibilities at home. How is it now that you're out of the home?
I mean, I can't say I wish I was back there, because it was my decision of getting out in the first place. But I think things are harder now than they were back then.
And why are they a little harder?
Because I'm by myself.
Okay.
I have like no support whatsoever.
Okay, and do you have a job right now?
I'm currently looking.
You're currently looking for a job. So how do you survive on a day to day?
Well, right now I'm at a homeless shelter.
Okay, and how does that feel for you right now?
I mean, not great, because when I was younger, I kind of frowned upon people that were homeless, because of the decisions that got them there. Because it was always drugs, and I didn't think I was ever going to be put in that situation, but I know I am now. So I don't feel as comfortable as I would want to be, and that's also a reason why I stopped doing drugs, because I want to do better for myself.
Okay. And since your family's not around, do you have a support system besides your family, friends, or anybody that you can count on in a relationship?
No.
So you're by yourself right now?
Yeah.
Okay. And do you wish that you had more connections with other people?
Well, yeah, but it was my actions that got me to here, so...
Okay. And at the homeless shelter, you haven't been able to make any friends or any acquaintances?
No, well, today's my first day being at the homeless shelter.
Okay. And before being at the homeless shelter?
I was locked up. Well, I was 5150.
Okay. So 5150.
Yeah.
Can you tell me a little bit about that? How long ago was that? You said it was about...
That was 3 days ago.
3 days ago? Okay.
I got 5150 3 days ago.
Okay. And how are you feeling right now that you're out?
Better. I mean, it wasn't the first time being 5150.
Okay.
I've had multiple times gone 5150.
Okay. About how many times in the past year?
Well, in the past 2 weeks, it's been a good, 3 times.
3 times. Okay.
Yeah.
And what usually do you feel triggers the...
I felt it was mainly my drug usage. I would get paranoid and stuff.
Okay.
So I think everybody was out to get me. The first time, I think I pulled a knife out of somebody at the store.
Okay.
I'm not 100% sure.
You're not sure? You don't remember?
No, I don't remember.
Okay. Had you used a lot that day?
Yeah.
Okay. And when we think about these 5150s and the experience that you had in there, do you think it was something positive for you going in there, or something that you needed?
I mean, yeah, because I was winding down from the drugs that I didn't have at the moment. But that was only 3 days.
So give you an opportunity to be clean.
Yeah.
Okay.
And then that's when I was out, since I didn't have nowhere else to go. I was pretty much at the streets and do drugs, since everybody does drugs there.
So do you feel like it was like you were able to see that this is something that you needed to go in to maybe get some help?
After the 3rd time, I guess so.
Yeah. Okay. And what about right now? Do you have any current thoughts of suicide? No thoughts? Okay. And have you had any history of harming others?
No. Well, just that time that I probably might have taken the knife out.
Where you're not sure what happened?
Well, I'm not sure. Could have been, that's why I got 5150.
Do you ever get aggressive?
Usually, yeah. Depending on how much drug I use.
Okay, so it's usually, if you are aggressive, it comes from the drug use.
Yeah.
So without the drug use, there's not a lot of aggression?
I don't think so.
Okay. And then, do you currently take any medications?
No.
No medications? And have you, besides the methamphetamines, have there been other drugs that you have a history of using, whether it's alcohol, marijuana?
Alcohol, marijuana. I've tried cocaine, but never really. I didn't like the feeling of it.
Okay.
And then I just pretty much skipped to heroin.
Okay, so
meth. I never tried heroin.
Okay. So with cocaine, it was just a one-time thing?
Yeah.
And how long ago was that?
That was about a year ago, I'm gonna say.
Okay. Was this prior to your first time using methamphetamines, or you had already used it?
I had already used it.
Okay. And what about marijuana?
Marijuana, that one I was using since I was 17, I'm gonna tell you.
Okay. Do you currently still use it?
No, because my drug of choice is meth, and it kind of doesn't, kind of messes it up, the feeling that I get.
The feeling that you get from it.
So I'd rather just do meth.
The meth. What about alcohol?
Oh yeah.
You currently use alcohol?
Mhm.
How often do you use alcohol?
I drink it every day. Well, right now I haven't because I was at the hold.
Mm-hmm.
But prior to that, pretty much every day.
That's a daily thing?
Yeah.
Okay. And how motivated do you feel to stopping the substance use, both methamphetamines and alcohol?
I think I want to stop. That's what I say right now. But excuse me, that's usually what happens when I come out of the hold.
So you feel like you might eventually get to a place that you might want to use again?
Well, I never fully stay clean more than 3 days.
Okay.
It's just while I'm in.
Okay.
So, passing the 4th day, maybe. I know I have to take it day by day, but.
But you do have concern over at least your methamphetamine use.
Yeah.
What about your alcohol use?
I mean, not really.
Not really. So it's something that you're okay with right now?
Yeah.
Okay. And then let's talk a little bit more about the substance use. Is there anybody in your family who had some history of maybe drug abuse or alcohol abuse?
Yeah, my dad is an alcoholic.
Your dad? Okay. Did you kind of grow up seeing him drinking, or how was that like?
Yeah, every day.
Every day. And was your father aggressive or?
No. He said he would drink to distress, but I mean he would drink his beers and then go to sleep. So I never really saw like. That's why I don't feel like alcohol is a problem for me.
Okay.
Because I never saw it being problematic growing up.
Okay. And so I know we have been mentioning, the methamphetamine use. Are there any other concerns that you have? I know that you were, recently on a 5150 hold. Are there concerns that you have there of the thoughts and feelings that you had? Anything that you want to work on?
No.
So you don't feel like there's something that you want to work on that with what's going on there? Okay.
Well, trying to stay clean, but.
So that's more your main concern is staying clean.
Yeah.
Okay. And then I'm gonna go a little more in depth with other questions. Again, here it might be, a little more personal, like some history of maybe some counseling that you had. So in the past, have you received counseling prior to today?
No, my parents did not believe in.
They didn't believe in therapy. What are your thoughts on therapy?
I mean, I've never been long enough to think that it would work.
Okay.
Well, I've only seen psychiatrists, not really a therapist.
So you haven't seen a therapist that, kind of just the sitting and talking and not really involved with medications. How open do you feel about, starting this process and kind of discovering things and kind of talking through some possible things that might be concerning to you?
Well, I mean, it's easier to have somebody that doesn't know me to talk about shit that I wouldn't really necessarily talk to anybody else about.
Okay, so you did mention that you did see a psychiatrist. Did you have a formal diagnosis?
Well, only the psychiatrist that I see when I get 5150 hold.
Okay, so those are the only psychiatrists you've seen. And did they ever give you a diagnosis?
I don't remember.
You don't remember? Okay, that's fine. And then, what do you hope to get out of counseling? What are your goals that you see for yourself or wanting to achieve?
I don't know.
You don't know?
Mm-mm.
Okay. So what about, I know you mentioned the drug use. Is that something that you would want to work on?
Yeah.
Here? Okay, so maybe reducing that and maybe some of the things that go along with it. What do you think are your personal strengths that you have that might help you kind of stay away from the drugs?
Motivation.
And what's that motivation for you?
Like staying clean, like finding a job.
Okay.
Are those goals?
Yeah, those definitely could be goals.
Oh.
So those are definitely goals that we can try to work on, whether it's, helping you through some of that anxiety that you might feel when you have to go in for a job interview. Or finding housing too, because I know right now you say you're at a homeless shelter, so you know, sometimes it might be difficult, you know, with the people that you interact there. And I know you probably have to kind of meet with case managers in there, and then maybe them pushing you to, you know, move things along, you know. So this is a place where you can kind of talk about that. We can work at setting some goals for you to, you know, find a place, or, you know, if we need to talk about, you know, some of the anxiety that you're feeling about jobs. So that's definitely something that we can set for goals for yourself. So that's something that you want?
Yeah.
Yeah. Okay. What do you use to cope? And I know that you use drugs as a way to kind of deal with things once you moved out of your parents' house. Are there other positive things that you enjoy that might help you deal with some of the situations that you're dealing with instead of, you know, going back to the drugs?
I like listening to music.
Listening to
That's
music?
my coping.
Okay. And do you happen to have like an MP3 player or something where you can play music on?
Yeah, I have my Obama phone.
Okay, so that could be something where, you know, find music, you know, that we can help you de-stress. Do you do any physical exercise?
Oh no.
No?
But you see me, I'm fat.
So you don't enjoy it?
No.
Okay. Okay, and that's fine. You know, everybody has different ways that they are able to manage things. So maybe exercise is not the thing for you. What about any arts?
No.
No? Okay.
I'm not talented.
You're not talented?
I could draw stick figures.
Hey, I can draw stick figures too, so
that's about it.
I wouldn't win any art competitions either. So it's okay. So it's sometimes it might be here trying to figure out what things work for you. Maybe not everything will. But we can kind of think and brainstorm some ideas of ways that you can, you know, have some coping skills. So we did talk about your goals of wanting to, you know, reduce your usage on meth. Are there any other things that you're hoping to gain out of counseling for yourself personally?
I don't understand your question.
Okay, so do you have any goals for yourself besides stopping the drug use and besides the finding a job? What do you hope to look like? Where do you want to be?
I mean, like a normal person.
Okay.
I mean, normal people my age, don't they have like a job and like have apartment or housing and, you know, do normal stuff.
Okay. So what does normal look like to you?
I don't know.
So I know you say a job and things, but what else? What about
like
friends?
having a boyfriend and being connected with their families and stuff like that.
What about you being able to be connected back to your family?
I mean, I would like that.
Okay.
I tried to get in contact with them, but it was when I was using.
Okay.
So that was also like a don't talk to me until you're clean kind of thing.
Okay, so, you know, maybe, you know, achieving that goal might make it a little easier for you to approach your family in the future, if that's something that you want to do.
Yeah.
Okay. So this drug use, I know you stated it kind of happened when you moved out of your family's house, and you said it was the added responsibility. Was there anything else going on at home that kind of pushed you to not want to do those responsibilities and decide to kind of just be on your own?
I mean, I felt I could do it by myself.
Okay.
Like, I didn't know it was going to be this hard.
Mm-hmm.
Like most 18-year-olds think is like, there's not a lot of responsibilities. But then once it kind of like, it hits you, it's too much when you don't have anybody.
Okay. And then, so I'm going to get into your family history a little bit. So I know you talked about your siblings. How old are your siblings?
Well, it's me and then it's she's now 17, and then a 14-year-old.
Okay, so they're a little younger than you are.
Yeah.
How close were you to them?
I was really, really close. I mean, they were kids when I was a teenager, but I felt like we were close.
Okay.
I don't know how to describe it.
Okay, and do you miss that connection that you
Yeah,
had?
of course I do.
Mm-hmm. So you definitely want to be able to have that connection, at least again with your siblings.
Yeah.
Okay.
That's what I miss the most, you could say.
Is that maybe a goal that you have of yours, to be able to have that relationship again with your sisters?
Well, yeah, but I first have to make my parents' relationship, or else I won't be able to see my siblings.
Okay. So those are definitely things that we can try to work on while we're here. So when we're looking about you leaving home, you're about 18 years old. Have you ever, thought about school? Like, when did you stop going to school?
I grad. I could have. I graduated. Yeah, I graduated high school. But we were never financially stable enough for me to ever think about doing anything else. It was like you turn 18, you get a job, you start helping the family, pretty much.
So you didn't think of college as an option for you?
No.
Do you want that as an option for you?
I mean, not now. I don't.
Okay.
I don't see the use of it.
Okay. And sometimes school isn't for everybody. Sometimes there are other things. You sometimes find, trade occupations or other things that you're talented in and good at doing. So school is not for everybody. So you said you did graduate high school,
Yeah.
so you were able to complete that. What about jobs? What, since you left home, I know things have been rough, but have you had any period of time where you had a stable job?
Yeah, I worked at McDonald's for like 4 months.
Okay. How did that feel when you worked?
I mean, it gave me a purpose to like get up and do stuff.
Okay.
But then started to drink a lot, and I just wouldn't show up anymore.
Okay.
And that's why they fired me.
Okay.
But that's the longest job I've had.
Okay. How did it feel having that job?
Good.
Good.
I mean, people always talk shit about McDonald's, but I mean, it made me feel like I needed to do something.
Okay. And then now I'm going to go into a little bit of questions that are really personal. And again, if this is a period of time where you feel uncomfortable, you can just go ahead and tell me. Have you ever had any history of physical abuse?
Yes.
Do you feel comfortable disclosing a little bit about that?
No.
You don't want to talk about
it? It was a long time ago, so I don't want to talk about it.
Okay, that's fine. If ever at any time you ever want to come back to it and talk about it, we'd be more than open to start a discussion about that. What about sexual abuse?
What entails in sexual abuse?
So when we're looking at sexual abuse, it could be many different things. So it could be, sexual contact that was unwanted. So it could be from a touch to unwanted sex.
I mean, yes.
Okay. Did you want to talk a little bit about that?
I mean, I was between the age of 10 and 14.
10 and 14.
Don't remember.
Okay. You don't remember a lot about that time?
I mean, I remember where it happened, who it was, but I don't remember how old I was.
And do you feel okay or comfortable disclosing who that person was?
Well, it was my cousin.
It was your cousin? Okay. And how long did it happen?
Oh, just one time.
Just one time? Okay. And did you ever tell anybody about the abuse that was happening?
No.
No.
I felt like it was normal.
Okay.
Like this happened.
Okay.
I don't know. We weren't really, like my family weren't really vocal about like the whole sex and all that stuff. So I didn't know what it was when it was currently happening to me. So I didn't know it was something you were supposed to like say. And then when I figured it out, it was a few years later. So there was no point to it.
Okay. And how did you feel when you kind of figured out that this was something that wasn't okay that happened to you?
I mean, you could feel like when it happened, you felt like it was not okay. But there's also stuff that I don't know, like culturally, there's stuff that you don't disclose.
Okay.
So I just felt like
you couldn't say it?
Yeah.
Okay. And so you kind of mentioned your culture. Do you mind telling me a little bit about your culture?
Well, it's because in my culture, the way that I grew up, sex was not a topic you talked about at all, whatsoever. So, like, your mom never told you, if somebody touches you this way, you should let somebody know, or sex is okay. Like, it was kind of always like the back burner that nobody really talked about it.
Mm-hmm.
So when you were put in situations like that, you didn't know what to say or how to say it because it was like,
You didn't know what to do. Maybe?
yeah,
Or,
like it was
like
different.
if it was
like,
okay to tell somebody.
yeah,
Okay. And was this cousin of yours somebody older than you?
yeah,
Okay. A lot older?
like I would say 2, 3, 4 years.
Okay. And have you had any contact with him in the last couple of years?
I haven't talked to him in about 7 years.
Okay, so it's been some time.
Yeah.
Okay. So when it was occurring, was it something that you would see him often?
Yeah.
Okay.
Every weekend.
Every weekend. Okay, so you would see him constantly. So I'm gonna touch a little more on abuse as well. So was there any emotional abuse at home?
No.
What about any past relationships?
Yeah.
Were they ever aggressive?
Yeah.
Okay. Do you want to tell me a little bit about that?
Nope.
Okay. So we'll just move on, and that's okay. And again, if you do ever want to talk about any of this, we can just go ahead and talk about it and kind of discuss it. This is always going to be an open forum for you. So you did mention again your culture. So do you feel comfortable disclosing about your culture or what you identify with? And,
Yeah,
okay,
that's fine.
your upbringing. Okay. Do you want to tell me a little bit?
Well, I mean, I'm Mexican American, but
Mm-hmm.
I will identify more as a Mexican because culturally, the way that I was brought up is pretty much like if we were still in Mexico, if that makes sense. Like
Okay.
everything around us was Spanish speaking. You only did Spanish. Like we only ate Mexican food.
Mm-hmm.
Like it was just like if we will go to Mexico every summer for 3 months. It didn't seem like it was anything different. Just over there was more freedom, you could say.
How connected are you with it now, with your culture?
Not that much. I mean, since I left home, I haven't really gone to Mexico. I learned how to cook a few things, but it's easier to cook like American food or whatever, however you say, like easier stuff.
Okay.
Cheaper.
And do you have any religious affiliations?
Well, when I was smaller, I would go to church. I would go to mass. I did my first communion, I baptized,
Mm-hmm.
confirmation, all that. But right now, I mean, I believe that there's a God, but I won't identify myself as a specific religion.
Okay. And so religion is not a role in your life that you want to maybe pursue?
I'm not sure. I mean,
Okay.
it could be eventually.
Okay.
It's not a priority.
Okay. So, is there anything else that you feel that, maybe we could touch on or that you feel is important for maybe me to know before we leave today?
Like, what do you mean?
So, anything else that maybe I didn't touch upon that you want to let me know about?
No.
No. So you think we kind of pretty much covered a lot of the issues that you want to kind of touch upon and things that we kind of want to discover in our next session?
I mean, for the first time, I would say so.
Okay. And again, I want to thank you for being so open and honest with all the questions that we asked. I know that they were very personal. But I want, again, reiterate, if you ever want to touch on anything again, please feel free to open that discussion up whenever we come up to another session. Always feel comfortable to go ahead and just kind of discuss that.
Okay.
Okay? Again, I want to thank you so much for your time.